Dogtown. So it is skin colored, which means that it's below the actual dermis, and it looks like it's gonna be a cyst. It's gonna be a epidermal cyst, and it's actually, if you want to draw it, I'll draw it out. The trick to these surgeries is to have a finger as an eye, and to first get the boundaries of the cyst, and you want to feel everywhere. Because when something is under the skin and it lifts the skin off, it easily fools the observer into thinking that it's actually all of this. The cyst this is its boundary. So if you look at this is the boundary, then you decide, okay, well, how tall is the cyst away? How much skin is lifted forward? And then you decide, okay, how much skin do I need to remove it so it looks good on day one? Because you can remove it, leave the skin, and it will shrink, but it will take a while to shrink properly. The next trick is a little bit of lidocaine or a little bit of fluid. And the reason we do this is not for pain, not for bleeding. It's for spreading the cyst away from the skin. As you can see, clearly is dissecting. And really, this is the only way to numb these. And you want to dissect it. Now you could clearly see that's the center of it, right? There's a little punctum, a little opening. That was the original sin, was that little hair follicle got infected, and while it was healing, it didn't realize that it was not healing properly, and it made a ball. Keep your eyes closed for this part because we're going to have some yucky, juicy stuff. How old are your kids?
12, 5, 6, and 7.
12, 5, 6, and 7. You did enough, huh? You did enough, huh?
Mm-hmm.
You got enough chaos in the house?
Oh, yeah.
Oh, that's cool. So this is what's called a perfect little dissection. See, the fluid made a space there. If I didn't do that, it would be impossible to keep the capsule. And this is a beautiful little fascial layer. This next bit I'll do for fun for you, because this looks like there's nothing on it, but that's all material. And that's the little fascial capsule that's forming. You see how it glides over it? So there's still a film on it. This is what people don't realize. See that film? And I don't have to do this. I'm doing this to show you guys that that film is still there, and the whole body is films and films and films. And this cyst decided to go deep, as we knew. Now, what structures here that you have to consider? And we just did it beautifully here. Beautiful little temporal branch. You never want to cut, because as soon as you're cutting, you are deciding something. And you never want to be deciding something, because if you don't understand all the little fibers that I just described to you, you will be forcing your decision onto the body. And then you're going to be cutting stuff that you shouldn't be cutting. Here, we didn't cut one thing, and we have the tumor out. One is the volume, but more importantly is you're not causing multiple layers. You're not injuring this. Look at this. It's zero bleeding because we didn't cut. That was the original wrapping. We unwrapped, right? We snuck into the wrapping. And that's why it's clean. You see that? Clean, no issues. There's zero chance that I injured anything. Most people would be scared to do a cyst here because of this temporal branch, right? So why are we not scared? Because if you see, there's no injury. It's original layering of the skin. So whatever she had before, that's what she has now. I'm gonna now to make it pretty. Which boundary? Exactly the one I drew. Because as soon as you now incise, or you make a new layer, what does the body do? Hemostasis. Now imagine this hemostasis issue all over the place. It's not fun. Beautiful, ma'am. You done did it. A+.